It's Wednesday and time for 10 Minutes of Truth. Today we're going to be talking about something that's been in the news a lot lately, especially with former President Biden, and that's the subject of prostate cancer. So we've all heard of former President Biden's woes, and I feel badly for the man. I don't wish, metastatic prostate cancer on anyone. However, I want you to understand some other things about prostate cancer and things to look at, because I believe it can be prevented long before it happens. So, prostate cancer is one of those common cancers affecting men globally. And, modern medicine is really good at figuring out what. They're good at figuring out, do you have cancer? Is there a tumor? Has it spread? And then treating the symptoms of the cancer. So treating the tumor with surgery, radiation, and hormone therapies. Functional medicine, however, in contrast, asks much deeper questions. For example, the functional medicine question of prostate cancer would be, why did the cancer happen in the first place? So we shift from a disease-centered systems approach to an approach that looks at what are the underlying issues that allowed the body to make or grow this cancer. So those include things like chronic inflammation, hormone dysregulation, detoxification impairment, metabolic dysfunction, immune compromise, and environmental toxicity. So instead of focusing on the tumor, we're focusing on what caused the tumor to grow. Okay, so it's really what we call a terrain focus. What's going on with the biological terrain that allows the tumor to generate? So we want to look at all of those things. Then we look at personalized risk stratification with functional diagnostics. So key diagnostics in that would include hormone profiling. So looking at the entire hormone panel, looking at which hormones are being converted into other hormones that are disruptive or dangerous to the body, and looking at things like that. We call them conversion enzyme activity, metabolic markers such as insulin, fasting insulin, glucose, things like that, detoxification pathways like phase 1 and phase 2 liver detoxification. Inflammatory markers are really important. Does this person have chronic inflammation? So we look at things like high sensitive C-reactive protein, inflammatory cytokines, ferritin, markers of that nature. And then we want to look at toxicity. Do they have heavy metal toxicity, such as cadmium and arsenic? Do they have endocrine disruptors, such as phthalates and bisphenol A, persistent organic pollutants? We want to look at what is their toxic burden that may be contributing to the fact that their body needs to make this tumor. Then we look at something, another thing that's really important, which is called the functional medicine timeline. It's a very powerful tool, and it looks at specific health and traumatic events in that person's life. So, example, have they had recurrent prostatitis or pelvic pain? And when did it start? Long-term occupational toxicant exposure. For example, if they worked with farm chemicals for a long time. Were they in the military, worked with chemicals? Were they exposed to industrial chemicals at a young age? Childhood trauma and unresolved psychological stress. How about circadian rhythm disruption? Do they have sleep apnea, chronic insomnia, Did they work a night shift? And was there a lot of sleep disruption in their life? And finally, have they had decades of poor glycemic or blood sugar control? All these things play in to why a person becomes unhealthy enough to give them cancer. So what are some of the things that functional medicine sees that conventional medicine misses with prostate cancer? So number one is, if you look at systemic root causes, conventional medicine focuses on the tumor location, size, and grade. Functional medicine, on the other hand, explores inflammation, metabolism, hormones, and immunity. You look at subclinical imbalances. In conventional medicine, they're often ignored or not even asked about. With functional medicine, we identify early stage dysfunction and pre-disease patterns. How about personalized risk? In functional medicine, you look at genetics, you look at toxicology, what's the lifestyle of the individual, and individualized timelines. Environmental toxins, never tested or considered in conventional medicine. In functional medicine, it evaluates heavy metals, plastics, pesticides, and other pollutants. Hormone metabolism. In conventional medicine, you measure total testosterone and or PSA. In functional medicine, you investigate hormone conversion, aromatization, and receptor activity. In other words, like how much of your testosterone is being converted to DHT, or how much of your testosterone is being converted to estradiol. Those things can be very important. Immune competency. In conventional medicine, they focus on infection or autoimmune diseases. That's not bad at all necessarily, but in functional medicine, we assess immune suppression. How well is the immune system working? Chronic inflammation. How fast is the immune system aging? Functional, in the category of gut immune axis, which a lot of our immune system is in our gut, this is completely overlooked in medicine. Functional medicine would evaluate microbiome health, intestinal permeability, and GI detox pathways. How about psychological stress? Rarely integrated in conventional medicine. Functional medicine would explore what are called HPA, or hypothalamic pituitary adrenal axis dysregulation, trauma, and what is the emotional resilience of the patient. And finally, we look at post-treatment terrain. So in conventional medicine, post-treatment is they look at follow-up, which is limited to recurrence. They monitor, make sure the tumor's not growing back. They monitor, a couple major hormones. But with functional medicine, we actively support recovery. We make sure detoxification is working properly. The immune system is restored. There's hormone balance, and the patient is actually in a state where they can heal. Again, in functional medicine, we look at genetic markers. In functional medicine, we look at what are called mind-body environmental integration. So, chronic stress, circadian rhythm, emotional trauma, toxic environments, and nutrient deficiencies. So with post-treatment, in functional medicine, we want to support mitochondrial function and cellular energy. It's very, very important. We want to restore hormonal equilibrium. We want to rebuild gut and immune function after radiation or chemotherapy. We want to enhance detoxification to eliminate treatment byproducts and residual toxins, which you would get from chemotherapy. And we want to reduce recurrent risk through dietary lifestyle and targeted supplementation. So ultimately, prevention is a cornerstone. So if your PSA is going up, these are things that we might want to look at. Like, what are your toxicity levels? What are your hormone levels? What kind of metabolic dysfunction do you have? How do you eat? How much do you exercise? Those are all things that are important. And so I think that I'm not saying that we shouldn't do conventional medicine. I'm not saying that at all. I'm saying that they're missing out on an enormous piece of the puzzle of why the patient is getting the problem in the first place. As I watched President Biden through his 4 years of presidency, I saw a lot of videos of him eating ice cream. I'm not saying the ice cream caused it, but, sugar and elevated insulin levels contribute a lot to the carcinogenic process. And so I think that, here's the most powerful man in the world who has access to the best medical care. And it just looked like there was a lot of things that weren't ever looked at that should have been, in my opinion, just looking from the outside in. So in my clinic here at Lincoln Disc and Nutrition, we want to look at all the things that I talked about. And, some of that involves some extensive testing, and that's really important. So if you're out there and you do have some issues with your prostate, you'd like to look at some of these issues and see if we can't resolve some things, I would say, come on in, talk to me, and let's see what we can do for you. And if we can prevent some things, great. If we can support your metabolism and make you healthier so you can get over the problem faster, that's another win for you. So here at Lincoln Disc and Nutrition, we're located at 4535 Normal Boulevard in Lincoln, and our number is 402-488-2220. So I would say this, call us up and at least talk to us and let us see if we can help you. In the meantime, we'll see you next week for another 10 Minutes of Truth. I hope this was helpful to you.